Hello, welcome to InSight. I'm your host, Wendy Brokaw, and our topic today is cancer. Why are so many people getting it at a younger age? How did the pandemic upend cancer treatment? And why is a new blood test holding so much promise in the fight against cancer? My guest today is Kathy Ottele. She is a volunteer with the American Cancer Society, District 6. Hello, Kathy. Welcome. And
Hello, Wendy. Thank you for your invitation today.
And congratulations, by the way, on your 25th anniversary as a volunteer with the American Cancer Society. Wow.
Thank you, Wendy. Yes, it's been a very important part of my life. 25 years ago, I walked in a relay here in Salem, Oregon, and after that, my heart just went there, and I'm spending more time now on the advocacy side of the American Cancer Society, working very hard in the Cancer Action Network.
Where do your travels take you?
Right now, in my national role, I represent District 6. That's the new district that we got here in Oregon because of the census changed. And so we now have Representative Andrea Salinas in Congress as our representative for District 6. So my job is to be her number one person when she needs questions and answers regarding cancer.
Well, you've really been busy getting the word out about the annual Lights of Hope event. What is that?
Lights of Hope is a event that happens through the summer months across America. And what Lights of Hope are small white bags that contain the name of someone who survived cancer or someone who lost their life to cancer. So each community, each volunteer all across America can choose what they want to do in order to honor these people, remember these people. We can have a display on our front porch. We can have something in a park. We can go down to the river. So it's an amazing event that will end in Washington, D.C. in September when we attend a lobby day, when we meet our senators and our representatives on their home turf. And the Lights of Hope bags are set around a park in Washington, D.C.
Where will we see events here and when?
Well, that's exciting, Wendy, because I decided this year with our Lights of Hope events that I wanted to have some displays in several places around Salem because our message to get screened is so important this year. I know, Wendy, you and I are going to talk about this a little bit more later. But right now, next weekend, July 29 and 30, people can go down to Salem Center and cross the bridge by Annie's Pretzels. It's on Center Street. It's the bridge on Center Street. And I'm going to have a display there. And people can look at Lights of Hope bags. They can make a donation if they'd like to find one themselves. And then later on in August, I'm going to be at Harley-Davidson. They now call themselves Timber Town. They have a women's ride that's going on, and I'll be there all day again, showing Lights of Hope bags and what we do. And then I'm going to end August on a very quiet Thursday night on August 31st. We will set our bags up on the steps of the Capitol, along with the sponsor signs from so many people here in Salem that are sponsoring this event, so that people can visually see the lighted bags. And that's the purpose. It's a message to our members of the legislature and of Congress that these people are important in our lives and they need to make fighting cancer a priority.
Where do the funds raised through the Lights of Hope campaign go?
It is so important that we do raise funds. All of our volunteers are volunteers, but it does take money to get our message out. Our objective for each of us volunteers is to work directly with an elected official. So it may be that we're right in our own hometown, but in order to go to DC in September and to carry our bags back there and meet our senators and our representatives, it takes money to bring all of us volunteers from all over the United States to that leadership summit and lobby day. So we just need support that helps us accomplish our mission.
And what is your mission?
It's really easy, actually. As volunteers, we are nonpartisan. We are fact-driven. when we have data that's supplied to us by the American Cancer Society, we have the information necessary to sit down with an elected official and to share our story so that we can influence them when it comes to making a policy or passing a law that can impact millions of people in the fight against cancer.
And each of you has your own cancer story to tell.
We sure do. You know, Wendy, that's the one thing I think that made it so easy to become a volunteer for the American Cancer Society Cancer Action Network. All of us volunteers have one thing in common, and you said it earlier, it's the word cancer. So each of us has their story, and we tell that story often. And for those that aren't comfortable telling it, we help them tell their story. But my story has been going on starting 25 years ago. My father died of pancreatic cancer, and then my mother died of multiple myeloma. And shortly thereafter, a younger sister, Pat, died of breast cancer. And that was her second time around. She beat it the first time, but it came back and it took her life. And then after that, I then lost my youngest sister, who was my best friend in life, and she had metastatic melanoma. So for me, it was very devastating to see these 4 family members lose their life to cancer, 4 different kinds of cancer. So I became empowered. I found that by using my story and using my voice, I had the ability not only to honor these family members, but to really truly help make a difference, not only here in Salem, but also in Washington, D.C.
Does cancer run in your family?
You know, it's a good question, Wendy. It's all 4 different kinds of cancer. So as far as I'm concerned, cancer just sucks. But I have been told that there are genetic indicators, and that you can do testing, genetic testing, and it depends on the types of cancers too. I do know simply that with my father and my grandparents being from Ireland, it wasn't probably a really good idea to move to Eastern Oregon and have your children grow up before they even invented sunscreen. So I myself, for example, I am a 5-time skin cancer survivor, having had melanoma, squamous cell carcinoma, basal cell carcinoma. It's just one of the things that it is genetic. But there are so many types of cancer that if we know what we should do, we can prevent them.
Cancer treatment during the pandemic, it was upended and people couldn't get it. And how did that affect? How did the pandemic, all 3 years of it, affect cancer treatment and people suffering from it?
That was a very hard time, Wendy. In those first few months, probably the first 6 months, especially when we had the shutdown, we actually had cancer patients passed away. There was an excellent article written by Dr. Bud Pierce, and he could actually give you the statistics of the number of patients who were receiving treatment and weren't able to continue that treatment. And knowing how devastating that was just right here in our small city of Salem, you can imagine across America. And then after that, when everybody was shut down, people didn't get screened anymore. They go, oh, well, there's too many other important things going on. I don't need to go get a mammogram. I don't need to have a PSA test. And it was harder for people that had symptoms to even go into an emergency room and try to get treated. So we have found that several areas are in dire straits. We just need to get that message out to people. Please go be screened, because cancers are now being diagnosed in later stages, 3rd and 4th stages. So it's difficult to treat and difficult to win that battle.
Why did people whose lives depended upon getting cancer treatments not get them? Why couldn't they get them?
Mostly it was just access to the health care. Wendy, here in Oregon, we're very, very fortunate with the Oregon Health Plan. For those that don't have insurance, if they should be diagnosed with cancer, they will be treated. They will be entered into the Oregon Health Plan. But it was just for a lot of people, they just didn't think it was important to keep those screenings current. And that's when we can detect cancer readily. And when we detect it early, we have an early cure.
I have been given to understand in my own research about cancer that so many people are getting it under the age of 50. And of those, so many are so young. What is going on?
It's interesting comment, Wendy, because again, ACS, the American Cancer Society, continually gathers data. And that's one of the things that's happened in the last 2 years is we're keeping data on when this cancer is being diagnosed and who's receiving it. So there's two areas that have changed that a lot of people don't realize. The message out now is for women not to wait until they're 50 to get that mammogram. Go when you're 40, or if there's a family history, or if you have a symptom. The other thing is definitely for the younger, maybe around 40-year-olds, we're having an increase in colorectal cancer. And these are being diagnosed also in later stages, which are more difficult to cure. So we encourage everyone in that generation, basically the first generation totally raised by processed foods. And it's a very sad cancer to get and to treat, but if you get it early, and most of the time we find that people don't want to go get a colonoscopy, or they don't want to go and talk to somebody about the fact that they're bleeding, have pain, especially for men. And so we're just encouraging everybody to don't ignore your symptoms. Go get it checked out.
Men with cancer, especially prostate cancer, things that people would regularly go and get screened for at a certain age, but so many are getting prostate cancer and aren't getting any screening whatsoever. That's one of the things you and I were talking about earlier.
Yes, that is happening. Not so much here in Oregon, again, because we do have access to testing. There are 11 states that did not expand into the Affordable Care Act. Many of us don't even realize that there are probably still over 40 some million Americans that have no access to health care. So we are finding pockets, ACS is finding pockets of populations, especially in minority areas, where there's a lot of inequities. And so we're looking at that. They discovered last year in 2022 that there was an uptick in prostate cancer for Black men. So ACS is focusing in those states. And we also then went to Congress. We have a bill in Congress now that would make no out-of-pocket expense for a man to get a PSA test so that they could detect prostate cancer. And that's one of the exciting things about our work as volunteers is we know we can go to Congress and we can ask for their help to make sure we can live healthy.
Is your support leading you to think that perhaps maybe some of the wish lists of things you'd like to see happen might just come true?
Oh, absolutely. Wendy, I know we're going to, at some point, I don't know if it's the best part, but after 25 years, I can tell you this is probably my most exciting year as a volunteer. And that excitement is the fact that in clinical trials right now, there is a blood test being developed that will detect at least 50 types of cancer.
Stop the presses, excuse me. A blood test that could actually, with one draw, be able to detect about 50 different types of cancers?
Yes, it is. And the exciting part too is one of the companies that has this in clinical trials is called Grail. And they have a Pathfinder 2 study up at OHSU here in Portland. And the second part of that study is now going on. And they've made affiliates with several of the hospitals in this area. And one of them is right here in Salem at Salem Health in their research center. They have a Pathfinder 2 study that people over the age of 50 who have not had any cancer treatment in the last 3 years. It's a free test. It's a free study to join. You go in and give your medical history. They take a blood sample. And within 2 to 3 weeks, you're given a phone call. And I joined that study and I got my phone call. And I can tell you right now, one of the best days of my life was to hear the voice on the other end of that phone say, Kathy, you have no cancer cells in your blood.
Oh, Kathy, how, well, and again, congratulations. That's just totally amazing from everything you've told me about your own cancer story. Congratulations.
Oh, it is truly going to change so much, so well. And it's going to change how fast we can diagnose cancer. And the exciting part too, Wendy, is this is where our volunteer work comes in. So when I go back to Washington, D.C. in September, and I'm sitting definitely with Representative Salinas, but a lot of us in our group get to also meet with the senators, although that's another person's primary role, but we're usually in the room. But for me to be able to say, I joined that study and I got that phone call, and me being cancer phobic from my family history and my own history, it is the best thing that someone could ever ask. The thing that's really encouraging too with this test is they're not just going to tell you that you have a cancer cell, they're going to tell you what type of cancer it is. So in this study, you will then be carried on through a diagnostic process and you will have your cancer treated. So I encourage everyone that has the opportunity, if you're 50 or older, get an appointment at Salem Health Cancer Research Center. Be part of this study. The more people we have in the study, the more data we have, the better our outcome will be. And then when in Washington, D.C., all of us volunteers, we got together with ACS CAN, and there's a bill in Congress. We've asked our senators to approve a bill that says when this test is, the study is finalized and this test is available, that we are asking that Medicare automatically covers this test.
What about people who would say, oh my gosh, I would love to be able to take that test, but I'm not 50, I'm much younger. Why can't they be part of this clinical trial?
That's a good question. And I'm not sure exactly how they're taking a lot of their participants, but I do know that the reason they're using 50 as the marker is because as we age, our immune system slows down. And it's our immune system that helps fight all types of cancer. So they know as we get older that we have a better chance of getting some type of cancer. So it may be that that's where we're going to find those early cancers for someone that may not know they currently have cancer.
Do you think it could possibly, just speculating here, be available for people at an earlier age at some point to be able to take this test?
Boy, I sure hope so. I think it's going to be one of those things that, just like a lot of things that we do with research nowadays, that as soon as it's a proven diagnostic tool, that it will be adopted. And that's the important part, a big part of what we do as volunteers, Wendy, because if we don't have that research, if that's not available, there's no way we can gather this data and then find results to what we're finding. So one of our big jobs every 2 years as volunteers with our elected officials is to make sure at the national level, for example, in the National Health Institute and the National Cancer Institute, we need that funding. We're always telling Congress, do not cut the budget, do not do that. We need that. We need that ongoing, because that's how we are finding these cures. We're finding the vaccines. We have vaccines now that can prevent cancer. So people just need to know that we're out there fighting every day and there are solutions.
Could you go over some of the major concerns you have, given all this research, that affects people who are in their 40s, perhaps, or even 30s or younger, that you really think they should do cancer screening?
It's very important, Wendy, that number one, we know our histories, know our families, what's happening with our families. So, most people, for example, would know if they've had a grandmother and a mother that had breast cancer. Then if you're a young woman in that family, to be very conscious about that type of thing. Some of the others are less, but I think when we're at the age of 40, it's also our choices in life. ACS was the first organization that linked smoking to lung cancer. That was a huge thing that happened 50, 60 years ago. And we're still fighting big tobacco, just so you know that. We're still fighting big tobacco. But it's a given that, if you smoke cigarettes, eventually you may end up with lung cancer. And actually, they've been able to tie other types of cancer to smoking cigarettes. Breast cancer, some colon cancer has been linked. And the one thing I love for people to do is to make sure that they are able to get answers if they wonder about those things, not necessarily just to Google something online, but we have a 1-800 number.
Quickly, tell us, what is that number?
It's 1-800-227-2345. That's a 24/7 number. It's the one thing that the American Cancer Society supports, even through COVID. There is someone there to answer the phone. They may not have your immediate answer, but they'll make sure you get the information you need at some point in time. So do not hesitate to contact the American Cancer Society.
Well, thank you. Thank you for giving that information to us. I look at America, and as urban as so many areas are, there are so many rural areas. How do you get screening there? How do you help people who really don't have easy access to cancer screening?
You know, it's one of our biggest obstacles all through America, but it's something that we are looking at really closely here in Oregon. I also serve on the American Cancer Society Board of Directors for Oregon and Southwest Washington. And we took all of the data that was established regarding cancer from the Oregon Health Authority, and we zeroed in on a community in Oregon that needed help. And it's an amazing story that's taken 2 years, but people are always looking at that, Wendy. But I think the biggest thing that we do is education. The more we can talk to people, and social media is important about that, that we can get messages out to people. But our doctors, our clinicians, people are out there waiting for us to say, I need your help. Please check me out. Ask for a biopsy, ask for a test. Don't ignore when something bleeds and then stops bleeding or comes back. Don't ignore pain. Those are often signs that there's cancer. And sometimes it is difficult for people. We know we have areas. I was in Bend here last fall, and we were listening to some of the horror stories of the people in the rural parts of our state over there that had to travel for, 2, 3, 4 hours just to get their cancer treatments. And so we have volunteer programs for that too. The ACS supports those programs. But it's terrible. We have people that are finding it harder and harder. I do know our 2 state senators are working on making sure that we even can improve on like the Zoom calls or the electronic medical areas, because we need people to get in touch with someone. But yeah, there's a lot of rural in Oregon. There's a lot of rural in America, and those people. There is an inequity when it comes to having access to care. Mm-hmm.
And that also includes people who don't have access to medical insurance. And that's a real factor when they're thinking about, well, what if I find out I do have cancer? I can't afford to get it treated.
Yeah. Yeah. And again, the 1-800 number is really great about that. Depending on where they live. I'll just give you an example of how that can work. Someone in Coos Bay that is diagnosed with, let's say their child is diagnosed with cancer. OHSU is the Child Cancer Center in Oregon. And so if they know that that's where their child has to go, they're going to call that 1-800 number and give them their zip code and say, okay, I have to travel all this way. Is there anybody that can help me? And that 1-800 number is going to be able to zero in on, is there a program that will support them as far as can they stay in Portland? We do have programs like that. We have motels that donate rooms or have rooms at less charge, or maybe there's an organization that gives out free gas cards, that type of thing. So it's all of us working together, not just ACS, but our community partners, to find the treatment and what's necessary to help those people.
Let's talk about prevention, because one of the things that is easiest to do is to say, wait a minute, I should be doing something that'll prevent myself getting in the need for cancer treatment in the first place. What can people do? Because especially since there's now a generation of young people growing up who had processed food, how has that affected them? And what can people do to stop? Really, how can they learn how to better treat their body so they don't get cancer in the first place?
Well, I think you said it just that way, Wendy. We need to be healthy, and that it's so important. Again, like I mentioned earlier in our talk, our immune systems are what help fight what comes into our body. So if we don't eat health, we don't eat those fruits and vegetables that we need, we don't have a healthy immune system. We need to look at all the external forces. I've mentioned smoking, alcohol. One of our biggest factors now that's impacting cancer is weight. So people that are obese, diabetes, type 2 diabetes is becoming prevalent. All of this type of thing is kind of like a vicious circle. So when we eat healthy and we try to stay active, we have a better chance of fighting cancer. After How about just something as simple as the sun? Because I'm the one that can tell you about that because of my 5 times skin cancers. Again, because that's my DNA. I know that, and I have to stay out of the sun or have sunscreen. As I mentioned earlier, I was too young when I was first receiving bad sunburns. So I had the damage happen to me when I was 10 and 15 years old, and they didn't have sunscreen back in those days. So it's important that we do that type of thing. There are things we can prevent, and we just have to think healthy.
Well, I know that there are a lot of DNA companies that also offer health
Mhm.
screening. Is that a factor that is a good thing that helps out? Sort of they can use the DNA test you've done for your genealogy to also help you screen for the susceptibility to cancers or
Oh,
other.
I'm sure it is. That's not my area of expertise or had any experience in, but again, I can't imagine that it wouldn't be that you learn history, learn what your history is, because sometimes we don't know what we've inherited versus what our environment, and our environment is very much a part of the cancer world too. The longer we collect data, and I'm sure you're reading it every day in the paper that they're discovering lead over here and they're discovering something else over there. And I read it each and every day. There's some new thing that could cause cancer. I think the latest one was aspartame in our Diet Coke or something. But then at the end of the article, it said you had to, consume 75 packets a day and, whatever. But it's still, we are exposed. Our human bodies are exposed to so much in our environment. And so the more we collect data, the more we can study and understand what is causing cancer.
Well, the American Cancer Society is data driven, and I want you to tell us if people want to learn more to help themselves understand cancer and to prevent it and to get part of clinical trials, everything. How do they get in touch with you?
Well, and get in touch with me. Actually, Wendy, there's 2 things. They can just go to, acs.org, because they're going to find all kinds of things on the American Cancer Society site. And my volunteer work with the Cancer Action Network is pretty easy too. It's fightcancer.org. So they're able to see exactly all the various things that we're involved in. But if they would like to just get in contact with me here in Salem, Kathy.Ottele@outlook.com. And I would be happy to meet with them, talk to them about volunteer work, share about Lights of Hope. It's just what I love to do. I do feel that that is my purpose right now. I have a passion for it. And the more people we have involved and the more people we have supporting our work, the better our outcome is going to be, and we're going to save lives.
Kathy, that 800 number again?
Oh, yes, I have it. It's 1-800-227-2345.
Kathy Ottele, you've been on InSight with us over the last decade, and it's been a long pandemic. It's so good to see you again, and I'm so glad that you were able to be my guest today on InSight.
It has been such an honor, Wendy, and we couldn't spend a better time together but to educate the people in our community, let them know there is hope. That's the thing I love about our Lights of Hope bags, because hope means that there will be solutions, and people should not ever not want to fight cancer. We're working hard. We're going to work hard to end cancer as we know it for everyone.
Well, on that note, which is about the brightest possible note of hope that I could imagine to end our program, thank you for joining us today on InSight, and thank all of you for joining us today on InSight. This is a wonderful time. Kathy Ottele with the American Cancer Society Cancer Network. Thank you.
Thank you, Wendy.